Welcome back. Coronavirus cases continue to soar across the nation and hospitals are near or at capacity. However, the CDC announced this week isolation and quarantine times are now shorter. To get a better understanding and perspective on why that decision is being made now, Dr. Christopher Doring, Vice President of Medical Affairs at Franciscan Health, is joining me this morning to talk more about it. Dr. Doring, good morning to you. Let's start with this latest surge. Why is the CDC loosening isolation restrictions now?
Yeah, a couple things. One, in the general population, we're seeing with especially the Omicron variant that the timeline from onset of symptoms, likely exposure to the time when you're no longer contagious, seems to be shorter than it has been with prior variants, and so that's really what's driving some of these changes. And then on the healthcare worker side of things, you know, we have been experiencing severe staffing shortages, a lot of challenges there, and so again, given that shorter timeline of the variant that seems to be becoming more predominant, being able to get folks cleared and back to work makes a big difference as well.
Do you think this is effective in limiting the spread?
That's a great question. There is still an expectation and a recommendation to be masked, even once someone's been cleared out to that full 10-day window. A lot of the benefit here is particularly for people who've been fully vaccinated. So I think the balancing act here is to try to maintain some level of normalcy with people who are not healthcare workers, and to be able to support the care that's needed for those who are really sick in the healthcare field. So I don't think these changes will significantly impact the spread of the virus. Seems to be following the data, which is the goal here.
When do you think when someone should get retested?
Yeah, that's a great question. Retesting is part of some of the algorithms, so it kind of depends on if you're vaccinated or not. If you're fully vaccinated and your symptoms are improving, or you never had symptoms, the CDC is not actually requiring or even recommending a retest. If you're not vaccinated, they do have a recommendation for being tested around that 5-day period after an exposure if you don't have symptoms.
And now we not only have the shots, Merck's and Pfizer's antiviral pills are expected to arrive in the state at any time now. Can you explain how doctors will actually determine who is a good candidate for these pills?
Yeah, so very similar to the monoclonal antibody criteria. This is really intended for folks who are at high risk for severe disease, people who are at high risk for hospitalization or even dying. So we'd be talking about people who are over the age of 65, people with significant underlying health issues, people with significant obesity. So there are some specific criteria part of the FDA's approval that kind of directs who should be receiving or getting these therapies. Unfortunately, there are a lot of drug interactions with the Pfizer product, and so not everyone who meets the eligibility criteria will be able to receive it because of some of those issues. But definitely a step in the right direction, and hopefully a great addition to our armamentarium here.
And we have less than 30 seconds to go. What's your reaction to the governor's decision to not reinstate a mask mandate?
Yeah, I mean, I think we all know masking makes a difference. It's an important thing to do, and so I think that the governor, for the most part throughout this pandemic, has been strong on recommending masking. It's really up to each and every one of us to make those decisions. Masking is really not so much about protecting yourself, it's about protecting others. And at a time right now when the virus is spreading, and you don't know necessarily whether you have it or are spreading it, I think the prudent thing is to be masked when you're out and about around people that you're not ordinarily with.
And because of these changes, at 7 o'clock this morning, Franciscan Health implemented new visitation guidelines. Who will now be allowed in?
Yeah, we still allow visitors for all of our patients, but we are limiting that to 1 per day. Okay. We're seeing that tightening of visitation at many hospitals and health systems around the state, and so certainly think, given the rapid spread of the Omicron and the increasing case numbers, it's an appropriate and prudent thing to do.
All right, Dr. Christopher Doring, VP at Franciscan Health, thank you so much for your time this morning. Really do appreciate it.
As always, glad to be with you.
All right, to watch this interview again and for more information relating to the coronavirus here in Indiana, we have more resources online at fox59.com.